Okay, I think we are good. We are live. Uh, Welcome to Namaste Debate. Today we have Dr. Biswas. He is working in Cambridge Hospital and he's also a health expert. I will basically allow him to speak more about himself. So, Dr. Biswas, welcome to Namaste Debate.
Oh, thank you for having me, Mani.
Yeah, thank you.
It's my pleasure and honor to be here today. I'm a physician. I'm actually anesthesiologist. So if you know anesthesiologist, we work mainly in operating room,
Right.
but we also work in obstetrics and emergency room, ICU. So we are all over the place and mainly deal with sick patients, critical patients, take care of the ventilation, breathing, and also treat like blood pressure and other stuff. If patient gets sick, you have to manage their vital signs and all the organs. So it relates to all kinds of medical issues in a person.
Yeah.
So
So,
I've
how
been
is life
here
right
and
now
came.
during the pandemic? Like overall, you're.
Pandemic is very difficult to work
Mhm.
actually in hospital. It has changed our lives
Mhm.
totally.
Okay.
So this started last year. Uh, it's about a year now since
Mhm.
the pandemic. And initially, we didn't know any much about this disease. How bad is it? How does it transmit? And what kind of precautions we have to take? So there were all kinds of webinars given by Ontario Medical Association and our colleges. And each week or every other day, there was a webinar about how to do this, how to do that.
Mhm.
And we were learning as we were going.
Okay.
So, and also there was as you may remember, there was problem with PPE, personal
Mhm.
protective
Right.
equipment. So we didn't have enough. So
Okay.
that was a huge scare initially
Okay.
because without PPE, you're gonna go to an infectious patient. It's like going to the war without any
Mm.
arms.
So
And
before I ask you more question, I just wanted to talk more about yourself. I see that you mentioned that you're also an assistant clinical professor at McMaster University. So tell us about more about that one.
yeah, we are a teaching facility, a satellite of McMaster. As
Mhm.
you know, Waterloo has a medical campus. It's a
Right.
part of what McMaster,
Mhm.
but actually works as almost independent.
Mhm.
It has about 15 or 20 students every year,
Mhm.
medical students. So they come through the same procedure as any other medical student goes to McMaster
Mhm.
or other medical schools.
Mhm.
But their main teaching, they stay here. So
Okay.
about 20 students, they live in Kitchener, in the campus near Victoria Street. So
Mhm.
all the classes happen here. And some of the lectures, they may have to go to Hamilton,
Okay.
but most of the classes, I would say 80%
Mhm.
classes happen here.
Mhm.
And after their second year of medical school, they come to the hospitals to do the clinical clinical training,
Okay.
and that's when they come to us. So
Okay.
each department, so they have rotations, like anesthesia or orthopedic medicine. So when
Okay.
they are in anesthesia rotation, there will be a student under me, and he will stay with me for a whole day, and I'll teach
Okay.
him different things. So
Okay.
that's how we are affiliated to McMaster as a adjunct clinical
So during the
professor.
pandemic, also you're able to do the same way, the teaching, like, or is it different?
No, that changed totally. Initially,
Okay.
for several months, there was no student. They were all
Okay.
doing online stuff.
Okay.
It's just started like a few months ago that
Mhm.
there are students, but they have limitations.
Mhm.
So they are not in the room all the time. When we are doing high risk procedures, they
Okay.
step out of the room. So they are not with us like before. Before they
Okay.
were with us all through. Anything we do, they
Mhm.
will be with us. But now there is limited.
Mhm.
Yeah.
Good.
And
And I
so
see. Yeah. Go ahead.
I came here in 2000. I
Okay.
did my medical school in India, Calcutta University, and then I came to US, did my residency training in anesthesiology in New York Medical
Okay.
College, near it's in Westchester County, north of New York City.
Okay.
Then I went to Mayo Clinic, Rochester, Minnesota, do a critical care fellowship for a year.
Okay.
Then I took my first job. At that point, you are thinking what to do, like where
Mhm.
to go. It's a dilemma, like,
Right.
as you all know. When you come
Right.
out of the country, you
Right.
don't know what to do. You want to go back, or you want
Yeah.
to stay here, or so I was in that kind of phase.
Mm-hmm.
And so I was looking for all kinds of jobs. And my first job, the best offer at that time, was in Newfoundland.
Mm-hmm.
So I went to Newfoundland, and my wife, I was married then. My
Okay.
wife had a relative in Canada as well, so in
Okay.
Waterloo actually.
Okay.
So we decided we would come to Canada. Then in 2000, that was in 96. And then in 2000, I came to Cambridge. I
Okay.
chose Cambridge because it was growing, it was
Was
the
it
right size for me. I wanted like a balance between uh, family life and work.
correct?
And so that worked very well.
Yeah,
Yeah.
I call Waterloo region God's own country. It's a mix of urban and rural region, right?
Yes. Yeah. It's a very good place. Yeah.
Yeah. Yeah.
It's a nice place.
Okay.
And
So yeah.
slowly
Yeah.
I got involved in hospital, like administration and stuff. Like I was
Okay.
president of medical staff,
Right.
then chief of the department, then was member of the board,
Mm-hmm.
and then I got involved in the foundation.
Right.
Foundation is the wing which raises money.
Right.
And you may not know, the public may not know that hospitals in Ontario, the government does not provide everything. They will
Mm-hmm.
provide the building, the concrete, the structure, but any equipment. So you have to fill with equipment, and that the town has to raise. So the people have
Mm-hmm.
to raise that money. So
Yeah, a
the
lot of
government
people
can
don't
give
know
you a
about this.
building. Yeah. So 100% of the equipment public has to raise. So that's a huge cost.
Mm-hmm.
Huge cost. Like
Mm-hmm.
you can have a building, and you just realize, like, if you have a house, how much it takes to furnish a house. So
Mm-hmm.
that same kind of concept is huge,
Right.
huge cost. So every year, public has to raise money. So it's important to participate in that endeavor, because otherwise you won't have proper equipment, you won't have up-to-date equipment, so you
Mm-hmm.
won't get the best treatment.
Okay.
So it's important.
Well, that's good to know. A lot of people don't know. Like they always think, is a universal healthcare means everything is covered by, province and our taxpayer money is all going there. But do you know what is the
Yeah.
percentage of? So basically, what would be the percentage? So out of 100%, how much the government is involved and how much you have to raise?
Okay. So I was involved with this new expansion in hospital, at
Right.
Cambridge Hospital. So I know the new building budget was about $250 million.
Okay.
And but to fill this is a totally new building.
Right.
And so we had to fill it with equipment and everything. And that was about $50 million.
Okay.
So 50 million plus every year you need replacement. So we had some excess instrument beds and other stuff. So we didn't have to buy everything probably.
Mm-hmm.
So
Mm-hmm.
that's why it was 50 million. But now we have a bigger hospital. So now every year we need $5 million just to replace old equipment and maybe
Okay.
get a couple of new equipment. So every year the foundation has to raise at least $5 million just to keep even, with the equipment and
Okay.
everything. So it's a lot of money for
Right.
smaller towns like Cambridge or North Dumfries, So it's a hard work for the foundation. So I would love to, encourage people to get involved in any way,
Mm-hmm.
any way.
Mm-hmm.
Like not just money, but also spreading the message, or participating in the events like Money You had done that.
Mm-hmm.
So those kind of things, very, very helpful.
Okay. So that's good to know. That's a lot of information. I think a lot of people may not know, but it's good now. You're sharing that information. So let's go with our first question. We'll go with the flow, and I believe probably I'm just expecting an hour time. So we'll go with the flow and see how much we can, how much information we can go with. My first question would be: how has pandemic impacted your life, and how have you been able to adapt and adjust to the new way of life? So I would like to hear your viewpoint as a doctor and as an individual family person.
Oh, pandemic has changed our lives totally. This is as the extreme change as it can get.
Mhm,
So many things have changed. The workplace has changed totally.
mhm,
So now um, we have to wear gear, PPE, which is very, very difficult to work with. So
mhm.
you have a N95 mask, which is like a tight fitting mask, thick mask,
Right,
and it's very difficult to keep it on for many hours, you know.
right.
And secondly, you have to wear a shield, face shield,
Mhm.
and it's sometimes difficult to see through that. Like even it's a transparent, but it's like an obstruction in front of
Correct,
you. You know,
correct,
before
correct.
we didn't have it. And thirdly, we have to wear a gown, a sterile gown or isolation gown with each
Mhm,
patient. So, so the thing about PPE is it's not it only works if you know how to use it properly.
okay.
So just wearing a face mask and a gown won't do it. You
Mhm,
have to know when you get contaminated, how to take it off, how to keep yourself clean. It's very, very important. That's why you hear from public, they're wearing masks, but they don't have that knowledge, like how to
mhm,
keep sterile.
mhm.
This what we get taught in medical school, how to keep yourself sterile in operating room.
Right,
Anytime you wear a sterile gloves, you have to always know, are you still sterile or not? So
right.
that concept actually helps people who work in OR like me. We know
Okay.
how to stay sterile, but I can assume that it's very, very difficult for others to think that, to maintain that.
Mhm,
The other thing is personal life. So that's one thing. So and in hospital now, we have gone better. We now test everybody for COVID
okay.
before they come to the operating room. But
Mhm,
before we had enough testing, we didn't have that testing. Like a few
okay.
months ago, we didn't
Okay.
have testing. So we had to assume that everybody is COVID positive,
Correct. Yeah.
unless proven otherwise. So
Yeah.
that adds a lot of stress,
Mhm,
and how we operate. Before operating room is very friendly environment actually usually, but
mhm.
with all these things, we cannot take off your mask or you
Correct.
cannot take your shield off. You cannot talk to others, freely. So it changed the total environment. It was very stressful, tiring, and yeah, that was a huge difference.
Mhm,
In our personal life, I'm at that stage now that I was started getting more traveling, trying to go to different places. Last year, before this COVID happened, I went to Switzerland with my wife
okay.
and went to Alaskan cruise. So
Okay.
my wife is a travel consultant, so we are
Oh,
getting
is it?
into that. I work as her assistant. I say I will carry the bags and serve
Okay.
the
Okay.
tea. So that's how we go. So we were doing all these kinds of trips,
Mhm.
and then suddenly all came to a halt, full stop. So
Right.
right now we cannot go. We should not go anywhere, and there's no point going anywhere if things are not normal there. So
Right.
how can you enjoy going to a place where it's not normal? So
Okay.
in my opinion, it will be a wastage of money. So that has changed a lot. So I miss that one a lot, the
Right.
traveling part. Um, I was trying to, I have developed few hobbies over the time. So
Okay.
one hobby which I like a lot now with traveling is I have started a sketchbook. So
Okay.
travel sketchbook. So it's
Okay.
like a 8 by 12 inches sketchbook. I
Mhm.
take color pencils,
Okay.
and if I get a time, like half an hour in a nice place, location, I sketch that scenery.
Mhm.
So that's like leaves an impression in my mind. You take a picture, photograph, you spend a few seconds, but if you sketching something, you're spending like half an hour. So you have a strong memory of that place. So I'm really excited about that. I have already made like 12, 15, like that.
Okay.
And so I'm gonna continue until it's full. So something I enjoy.
So you like drawing, like you already drawing, or it was like a sudden change that you wanted to pursue in this direction?
No, I like arts.
Okay.
In my heart I like arts.
Okay.
So I see it's been inside me,
Mm-hmm.
since his childhood, and never got time to do much.
Yeah.
But for a few years, I was thinking now I should start. As you're getting older,
Mm-hmm.
and I started this like couple of years ago now.
Mm-hmm.
So I do paint as well. So
Okay.
if you paint like acrylic, mainly acrylic on canvas,
Mm-hmm.
and that's a series I call Beautiful World.
Okay.
So I try to capture uh, scenery, but it's impressionist. Like it is
Okay.
not an exact copy of the what you see,
All right.
but it's my impression of the scenery. My goal is to have bright colors, beautiful, so it should look beautiful. If you first look at it, you should see it's beautiful.
Yeah.
And so I made one for the hospital as well. First painting for the hospital from the other side of Grand River. If you,
Okay.
I don't know if you ever gone that way. If you
No.
go other
Okay.
side of Grand River, you can see the hospital and the golf course.
Okay.
And in the fall time, there's a beautiful trees, colors, and the hospital. So that was the occasion when the new building was being built and the old building, and there was a tall crane connecting the two.
Okay.
So I captured that moment, and that came out very nice.
Oh, is it?
And so, yeah, I will show you one.
Yeah, sure.
So
Well,
that inspired me to more,
okay.
and then I painted one for a charity event. It's
Okay.
called End of Fall. So when end of fall, when the tree, I like that scenery, when a tree has only few leaves left,
Mm-hmm.
near the end of fall. So tree is trying to fight to retain those leaves.
Right.
So it's like a struggle with the nature, and it
Right.
has some meaning in it. So I
Right.
had captured that, and that was actually I donated to a charity event, and that got sold. So I was so
Yeah,
happy.
okay. Okay.
Yeah.
So that's good to know about yourself, and it's good you are into arts and all that. That's good to know. Probably, later on we'll you can share with me, what
Yeah,
all some
love
other.
to. Yeah,
Okay,
love
my
to. Yeah.
my next question is, what is the worst outcome of this pandemic? So we all know, like, what is the worst, and we have seen, a lot of deaths, but I just wanted to know, like, do you think there are also some positive that came out of this pandemic in terms of how human beings are changing and adapting to this new world?
Oh yeah, everything has positive and negative. So right now we can see the negative part more because of the deaths we are seeing, and restriction to our livelihoods and all that. So that's pretty negative. And I must say that Canadian government is trying their best. Every government is actually, it's very, very tough
Mhm.
to manage this kind of pandemic when you don't have experience,
Right.
with this. This is a once in 100 years. So positive things is, I think number one positive thing I'm seeing that people have become more human.
Mm.
They're realizing the most important thing in life,
Right.
is living. So, uh, so that's a positive thing on personal level in everybody's life. That
Hmm.
just to stay alive is the most important thing.
Right.
And and then the family values, people are getting more appreciating their families more, and they're connecting with people who they never connected in the past. I'm doing that as well, like calling people
Right.
I haven't called for many, many years. And also the way we work, like we can work with less resources,
Hmm.
like that's another uh, another lesson. Like in hospital, we have to restrict lots of activities and this and that, and it still provided the essential service. So
Mm-hmm.
that was a lesson, like, okay, we can still do our important job
Mm-hmm.
without having everything in place. Like at few occasions, several months ago, we were in actually risk of shortage of medication, important medications, essential,
Okay.
urgent
Okay.
medications.
Okay.
So at that point, we had to triage, say, okay, how we can uh, use these supplies to save lives,
Right.
and how to use other things, alternatives,
Mm-hmm.
to do less risky stuff. So those kind of things, you can adaptation was another lesson, I think, was
Okay.
positive. People learned how to adapt.
Mm-hmm.
And same thing with the cleanliness, that's another thing, big thing. I think one big thing will come out from this. People will learn cleanliness, how
Right.
to keep
Hygiene.
themselves clean, how to keep hygiene, keep the workplaces clean. Aeroplanes, they will
Right.
do a much better job, how to keep the air clean, and how many, you know, what kind of things are important to keep
Mm-hmm.
the infection low. So I think those kind of things are positive.
Okay.
And yeah.
Okay. Good. My next question is, I think you answered to some extent. As a doctor, how are you protecting yourself from COVID-19 and your family while you're working in hospital? You talked about protecting yourself in the hospital, but when you come home, like how was that experience? How was your family taking, all those precautions, those kind of things?
Yeah, that's a tough one, because
Mhm.
it's not easy. You may have heard stories like people living in trailers, who nurses who are working in
Mhm.
urgent care, this and that. They will stay away from family.
Mhm.
Um, that's very hard, obviously,
Okay.
and not practical in my case. So I
Mhm.
made some changes,
Right.
like so. So in hospital we have a screening. So as every time you go, there's one entrance for employees and physicians.
Mhm.
So everybody gets a screen, like questionnaire,
Okay.
and then we use the gowns, wear the scrubs in the hospital. So I was doing more hand washing and other stuff. We'll be very
Mhm.
careful and never take off my mask and the
Okay.
shield in the hospital.
Okay.
I have been very strict with
Mhm.
with this. So I
Mhm.
stay protected in hospital as much as I can.
Mhm.
So when I come out of the hospital, before I used to, just uh, clothes, go upstairs, change the clothes, wear it for next day, that kind of thing. But
Mhm.
now I uh, stay on the when I enter the home and the house, I go to the change room near the washroom and put all those clothes in the washer every day.
Okay.
So, and we have another like house coat. So wear that
Mhm.
house coat, go upstairs and wash my
Okay.
hand, face, and everything before I talk to any family member. So once I wash my face and hand, and then I change into house clothes, and then I say
Mhm.
hi to my family.
Oh,
So that's the step I take.
okay.
And main thing is you don't put yourself at risk. Like
Right.
you don't go out, so
Correct. Yeah.
you have to stay safe all the time.
Mhm.
And so that means wearing the mask if you're talking to somebody else. So in hospital, everybody's outsider. So I never take mask off. So same thing applies when you are not a medical person. If you are talking to somebody outside your household, never
Mhm.
talk without a mask. Never take off your mask. Even if you're outside, even if you are like outside talking to somebody. I
So
know
how often you
people,
get
stay.
tested in the hospital?
Sorry.
How often you get tested in the office? Like, and how fast is the testing result? Like for the COVID, like how often
You
do you
get
get?
only tested. You get only tested if you have symptoms. So I have never been
Oh,
tested. I've
oh,
never been tested.
Oh,
So
okay.
if I had symptoms, I will be get tested. So there's
Oh,
no point testing you unless you have symptoms. So there have been lots of people who have been tested.
right.
So it
Okay.
takes couple of days for the results to come out. But when you have symptoms, you have to isolate and get tested,
Okay.
and then follow the instructions. So it depends.
So
So
what is the
luckily, knock wood, I have not been
yeah,
tested.
okay. So what is the based on the testing technologies we have right now? What is the fastest way to get tested, and how long does it take? Like usually it takes
There's a
1 or 2 days or what?
2 days, yeah. That's
Okay.
the PCR testing.
Right.
That's a more reliable testing.
Okay.
But there's an antigen testing coming out. That's a
Okay.
quick. You will
Okay.
know your result within an hour,
Okay.
and that's only 60% accurate or something.
Okay.
But PCR testing is more 90% accurate. So
Okay.
um, so now they are suggesting, like, not in hospital but other workplaces, they're gonna roll out this antigen testing.
Okay.
So immediately you may know, at least screen some people who may have positive, uh, and then get the PCR testing more,
Mhm.
appropriate testing.
Okay.
So it's you get tested only if you have symptoms, or
Okay.
you have been exposed. You think you have been exposed
Oh, okay.
to somebody who had COVID. So there's no point going. If you're healthy, don't recall any exposure. There's no point going and testing.
So was it the same protocol when it all started, or it changed later on, and then they decided, there's no point doing it, or was it the same from the beginning, or it changed later on for the testing of?
Well, it was the same. It was the same.
Okay.
Like before, we had shortage of testing, so we
Right.
weren't even like we were not even testing. Even you had symptoms. If you
Right.
have symptoms, you go home, isolate for 2 weeks,
Oh, okay.
and now we have testing available. So if you have symptoms, you can choose to get tested to rule out that. If you want to say, like, I don't have COVID, so then you have to
Okay.
get tested. Before, it was like a shortage of testing. So
Okay.
if you have any symptoms or anything, they were sent home and
Okay.
isolate.
So all these medical supplies, mostly in the hospitals, are they like local, or they being imported? Like, how dependent are we from outside in terms of the regular medical supply also in Canada?
It's very difficult to say.
Okay.
We were in a business
Hmm.
before this COVID happened.
Okay.
Everything was made in China.
Oh, is it okay?
Even if the local company, Canadian company,
Okay.
but when you look at the label, made in China, is like a suppliers,
Right. Okay.
right? So it's very
Distributors.
difficult to know, like, did they make it here or not? But ultimately, when
Okay.
you look in the fine print, it was made in China. So,
Hmm.
and so slowly, I think still majority of the supply is coming from China.
Okay.
And
Are the medical supply means medicines? Are you talking about everything, or is just
the
equipment?
medicines are produced probably here.
Okay.
Medicines are produced here. I'm just saying other supplies,
Yeah, supplies.
like
Okay.
masks and gowns and
Right. Okay.
those kind of things. But medicines are made here, and in US as well, US
Yeah.
here, and maybe Mexico. I don't know exactly
Right. Okay.
all the countries.
Okay.
I don't think medicines are made in China,
Okay.
but other supplies, you
Hmm.
know, they're they're still made in China. So
Hmm.
we have some local manufacturers about mask and
Hmm.
a few other things, shields, ventilators, this and that.
Hmm.
But I still see majority in China.
So still you feel that we are still not, like, in terms of the procurement, we are not doing more like made in Canada items, like in terms of mask, PPE, or is that still in the mix right now?
It's a still in the mix. I think I don't have the answer for this. Like, for a
Okay.
good business model, will that be the best thing? I don't know, if to make everything here. Will that be viable? In long run, you
No, I
can
mean
start making.
essential items. At least I believe things that we need for sure, right? For life, life, death, safety, all those things.
Yeah. So essential medications are made here,
Okay.
and maybe the government is thinking about making the N95 masks more
Mm-hmm.
here, or isolation gowns, those kind of things, essential ones,
Okay.
But for the long run, these companies, you have to keep the cost down,
Yeah.
right?
Okay.
Otherwise, our costs will go so high. If
Mm-hmm.
we can make things here, but if they can't compete price
Mm-hmm.
wise,
Mm-hmm.
how you survive that business model?
Yeah.
I don't know.
Okay.
Yeah.
Okay. My next question is, very often, once in a while, we see headlines saying outbreak in the hospital. So my question is, what happens when COVID-19 outbreak is declared in a hospital or ward, and what are the standard operating procedures that hospitals usually follow? Like the headlines is outbreak, it makes people, worried, like something happened. Like what does that mean? Yeah.
Yeah, that's a good point. And you'll be surprised to know that sometimes I hear about our outbreak in our own hospital from news media rather than
Mhm.
from the hospital, because nothing changes. Nothing
Okay.
changes. And I go to the hospital, oh, nothing has changed. It says outbreak,
Yeah, okay.
there'll be fires everywhere or that kind of
Right.
thing. But nothing changes. It's just the outbreak in a ward. Wards are
Okay.
divided, they're different
Yeah.
floors, and they're specific for certain kind of patients.
Hmm.
And particular staff work in that ward, and doctors may go to different wards.
Hmm.
So when a outbreak is declared in a ward, so significant number of patients have been positive, and
Hmm.
also the staff have been positive.
Okay.
So what do they do is they stop admission to that ward. So they close the ward. So that
Okay.
means the staff who have been affected, they are quarantined. They go home. They don't come, and only limited staff are in that ward. They are not allowed to work anywhere else. They just come
Okay.
to that ward, take care of the patients, and we have to wear all the full isolation gowns. The PPE. So before they were not wearing like full PPE. That's okay. You don't have to wear full PPE
Mhm.
to treat a normal patient. You just have to wear
Right.
gloves and a
Hmm.
mask and a face shield. But full PPE is like N95 mask, those kind of
Hmm.
things. So once the outbreak happens, then you start wearing full PPE, limited access to the ward. So only restricted people can come in, no visitors allowed. And that will be like that until uh, the people who have been positive recover. They go through that quarantine time, and then repeat testing came negative, those kind of things.
So do
So
you
actually, it's not a earth-shattering
right? Okay.
event. It's a normal occurrence. It's a safety thing,
Okay.
and this outbreak, it does not affect other wards, other places. It
Okay.
just affects one single ward, and hospital can function easily without it. So
So the outbreak is like what? Is a one or two patient they test, or is a symptom wise they decide like how they term the outbreak? Like somebody in the hospital basically calls the media and says there's an outbreak. Like I sometimes feel it's sensation. The media cap
mm.
headlines, right?
I was trying to look into that, like what's the classification of an outbreak.
Right.
I think I didn't get time to find
Hmm.
that. There must be a definition.
Okay.
There can be one or two patients, but it's not an outbreak. So
Right.
outbreak is, I think, when in my thinking is when the disease from patient transmits to the staff
Correct.
as well.
Correct. Yeah.
So there's significant number of patients as well as significant number of staff who have been positive. The staff who were not exposed outside, but that their
Mhm.
COVID is not from some
Right.
other, so most likely from the hospital. So then they classify that as an outbreak.
So hopefully somebody is doing a proper what do you call it contact tracing. Because initially everyone wanted to do that. I think then they decided that it's way too much. Now I don't think there's a lot of emphasis on contact tracing, how you got it and all those things, right?
Yes, because we have found out like contact tracing was not that helpful actually,
Yeah.
because people were getting without any contact, and
Mm-hmm.
so people cannot recall, or people didn't go anywhere, and people were still getting it. So
Mm-hmm.
that emphasis on contact tracing has reduced, I think, as a result.
My next question is, can asymptomatic patients transmit disease? I'm hearing, initially I heard there is a possibility. Now a lot of research are being done. They think it's not. What's your take on it?
And still we don't know.
Okay.
Still we don't know. That's the whole crux of the problem. Like,
Mhm.
uh, if you don't have symptom, that means you can move around nicely.
Right.
Don't wear mask. Those kind of things. So looks like uh, now know we are learning that
Mhm.
everybody has to wear mask. Doesn't matter you are symptomatic or asymptomatic.
Mhm.
You cannot take somebody who is asymptomatic as without risk. So
Okay.
as I was saying you before, if you're talking to somebody who is outside your household, who has no symptoms,
Mhm.
you cannot assume he won't be able to transmit, or he doesn't have COVID.
Mhm.
So you have to treat, in this pandemic, you have to treat everybody as if they have COVID
Mhm.
outside your household.
Mhm.
So if you follow this simple guideline, treat everybody outside your household as if they have COVID, then
Mhm.
you will be safe.
Mhm.
So that means if you're going to talk to anybody outside your household, you're going to wear a mask. You're not going to take off your mask. You're
Mhm.
going to wash your hand before and after
Mhm.
seeing that person, even if you haven't touched too much.
Mhm.
You're going to stay a little bit far. Even if you're talking, try to stay like 2 meters
Right.
apart. So uh, try to follow this. Just a simple basic. That's what I'm doing. I treat everybody as if they have
Right.
COVID
Right.
outside my household.
Right. Okay. Good. My next question is, when a patient is admitted in the hospital, especially COVID positive, what medicine and treatment they generally receive? Of course, now we have vaccination, but when there was no vaccination, or even if we have vaccination, what is generally they do? Like when they get admitted, uh, like what medicine or treatment they usually get and how they recover?
Yeah, I don't treat COVID patients, but I was talking to my friends, colleagues.
Mm-hmm.
So they are treated as if they have a respiratory infection. So
Oh,
they get antibiotic or oxygen, those kind of things.
okay.
And if they're getting short of breath, or becoming oxygen saturation is going down,
Mm-hmm.
then they also get a steroid called dexamethasone,
Okay.
okay, which is cheap steroid given once a day
Okay.
orally.
Okay.
We are not giving any those convalescent serum, those kind of things,
Mm-hmm.
or remdesivir. We are not giving those things here.
Okay.
Yeah. So we are treating them as if they have a respiratory infection with antibiotics and other things, and some oxygen. And
Mm-hmm.
if it gets further worse, then giving steroids.
How is the
So
ventilator position right now? Do we have enough, or are we still like struggling, or what do you think?
yeah, we have enough ventilators, but occupancy right now is high. Right now, ICU uh, occupancy is 110% in Cambridge, I think.
Oh, is it
So
okay?
we have 12 beds. So we have 13 patients admitted.
Yeah.
But we have capacity to surge, means have extra beds
Mm-hmm.
available if needed. So we create
Right.
um, ICU kind of bed, you know,
Right.
adjacent ward. So with the staffing, with equipment and everything. And I think we are okay with the ventilators.
Okay.
And at this day and age, you may have heard like the staffing can be the main issue,
Okay.
to have the proper staffing to look after the patients.
Mm-hmm.
So if some people are off because of quarantine,
Correct.
you may not have enough people like staff,
Right.
qualified
Right.
staff. So that can be very stressful.
Mm. Did you have cases of doctors or anybody getting COVID, or it's just the numbers are very low?
Personally, I don't know any
Okay.
doctor um, who had COVID, but I heard
Okay.
nobody wants to share this information.
Right. Okay.
so so I heard that there were a couple of people who had to quarantine,
Mhm.
physicians, and but nobody, touch wood, nobody has been
Okay.
seriously ill. Seriously ill. Yeah.
I don't know if you know or not. In India, I don't know. Things might have changed, but initially,
Mm.
regardless if you're a doctor or somebody, if you get COVID, the government official will come to know, and somebody will come outside your house, and they will actually put a sign saying there's a COVID positive patient living here.
No, that's not very good thing. Yeah.
Yeah. So I know
No privacy, like
no
patient
privacy and
confidentiality. Yeah.
a lot of issues. I know one of my friend. Um, they got like COVID probably in early March of 2020, and they got it through somebody visiting from UK to their company, and they had a meeting, and that's how. So initially, even the cops filed an FIR. It's a case like, why did you walk? They didn't even know, like they don't know, what to do, and they were on surveillance and all those things because initially people, they didn't know what to do, so they wanted to do contact tracing, and there was a lot of social taboo. Like once we put that sign outside, your neighbors, relatives, tend to keep little distance, right?
Yeah. Yeah. That's I mean, we should respect patient
Yeah.
confidentiality and COVID. Yeah, I mean, obviously, that's why you have to stay safe with
Mhm.
anybody outside your household. I mean, if somebody has COVID, obviously you have to stay safe from them, but
Mhm.
it doesn't mean that you will be not safe with somebody who doesn't have COVID.
Right.
So that's the key nowadays, that you have to play safe with everybody.
Right. So now I want to talk about the vaccination part. So can you talk a little bit about the different types of vaccine available and their efficacy level? Like there is Moderna, we have the Oxford, and I saw there are a couple of other countries also involved in this. But today I was reading the one, the Chinese vaccination. I think in Brazil when they tested, they only saw it's only 50% effective.
Yeah. You know, people are very curious about vaccines nowadays. Before, we didn't have much interest in vaccines. We take
Right,
it for granted.
right,
And we all from India, we used to have lots of vaccines as a children.
yeah,
And then here also, there actually, if people don't know maybe, but you have to get vaccinated. There's a vaccination schedule even for
yeah.
adults. Like
Correct.
you have to renew your tetanus vaccine every 10 years and other things. And if you go to India, you had to take vaccines. Very few people used to take it.
Hmm.
But typhoid vaccine, this vaccine, that vaccine
Hmm.
for full protection.
Hmm.
So there's like flu vaccine every year, for
Hmm.
example, that's only 40% effective.
Hmm.
You take it, you may still get flu, but less, maybe less.
Hmm.
So with this vaccination, it's the same concept.
Hmm.
Like if you take a vaccine, most likely you may still get it, but it'll be less. It may not kill you.
Right.
So that surety in itself, you know, if you get that surety in itself
Right.
is valid reason to get any
Correct.
kind of vaccine.
Correct. Correct.
So that's the to start off. So vaccine, if you are able to get a vaccine, get it. You know, and
Hmm.
these vaccines, these are not some shop, making a
Right.
mixture. These are reputed companies doing research and then coming out with vaccine.
Mhm.
And if any problem happens, they're liable. They will be liable. So
Mhm.
they have a huge interest in having safe vaccine.
Mhm.
So currently we have Pfizer BioNTech. That's the first vaccine that was approved.
Mhm.
It's a new technology. It's called messenger RNA. So
Okay.
in a cell, there's RNA. This is a protein, like a
Okay.
genetic code.
Okay.
There's DNA. DNA is your genetic code, but there's
Right.
other proteins which also help in making other chemicals and
I see. Yeah.
things. That's called messenger RNA.
Okay.
And so they take this messenger RNA from the spike, this coronavirus, which is like a sun, with the
Right.
spikes.
Right.
So one of the spikes, they take this messenger, the RNA, and
Mhm.
put it in another cell. And that's when injected in you, the
Mhm.
body will read it as a foreign protein and make antibodies against that.
Okay.
And that's enough. That antibody will fight against this spike of coronavirus
Mhm.
and help you from getting infected. So that's called messenger RNA. It's a new technology. It has been probably, they have been working on this for many years. This
Okay.
is the first time they have come out with a product like
Okay.
for use.
So all the vaccination companies are making only this
So the Pfizer made this. No, everybody has different. Lots of
different
people
year.
have different technology.
Right.
So the messenger RNA, and then Moderna is the same thing. Messenger RNA for different messenger RNA, not the same.
Okay.
So cell may have different RNAs.
Okay.
And AstraZeneca had that took a part of the DNA, I think,
Okay.
okay, of the virus, and
Okay.
then put in another dead virus, adenovirus,
Right.
like a
Okay.
common virus we have,
Okay.
adenovirus. Harmless. Those are not
Right.
very harmful, harmless virus.
Right.
And that is injected. So then body makes mm, antibodies against that.
Antibody.
So that's called adenovirus vector.
Mhm.
Then latest is Johnson and Johnson. It's the
Right.
same concept. They're part of the, I think, DNA and put it in a
Mhm.
adenovirus. So
Mhm.
it's similar to AstraZeneca,
Mhm.
the Johnson and Johnson one.
Mhm.
And Johnson and Johnson advantage is that you have to take only one dose.
Right.
AstraZeneca, you have to take 2 doses, Moderna, 2 doses, and Pfizer. AstraZeneca has not been approved yet. Only Moderna and Pfizer have been approved in Canada.
Oh, is it? Okay.
AstraZeneca, there was some problem with the dosing, 2 doses. There was
Okay.
some discrepancy. Like initially, they gave smaller dose, first dose, and larger second dose, something like that. And
Mhm.
with the smaller dose, they had a better result. So that
Mhm.
was kind of confusing. So that's why Canadian scientists are still looking into it. It has not been approved. Will be approved shortly. It has been approved in UK
Okay.
and EU, I think, and India as well, I think, because India, um, Covishield, the Indian Serum Institute,
Right.
they had a collaboration with AstraZeneca, so they are producing that. So
Okay.
Covishield is same as AstraZeneca Oxford vaccine. Then there's a Novavax. That's another technology. It's a protein nanoparticles from
Mhm.
the virus, I think. So that's
Okay.
not been that's in testing still.
Mhm.
Then there's a Sanofi. That's recombinant protein. So that's a you take a protein and then you alter that protein. So that's another technology. And there's another one, GSK, virus-like particles with protein. So there are different kinds of technologies trying
Mhm.
to produce. But
Okay.
normal procedure of uh, of this vaccines is you take the virus
Mhm.
and you kill that virus. You kill that
Right.
virus, so
Right.
it's not virulent anymore.
Right.
Then that virus is injected.
Okay.
So dead virus. So that will not cause infection, but that will stimulate your body to produce antibodies against that virus.
Mhm.
So that's a normal, lots of normal vaccines are like that. So that's the technology the other Indian vaccine is using. I forget the name. So
Biotech.
biotech, yeah,
Mhm.
the bio something.
Right.
So thing is, they have not tested it. They have not come out with phase 3 trial.
Right.
So there are three. You have to go through 3 trials to get the full study.
Right.
Phase 1, phase 2, phase 3. Phase 3 is a bigger, multiple people, lots of people, follow over a few months, see
Mhm.
the problems or efficacy. So that hasn't been done in that bio vaccine in India, and but it's been approved. So that's why people are having lots of hesitation.
Right. So
So
right
we
now
don't
here
know
in
how
Canada,
effective
two
that is.
vaccination approved, right?
Canada only 2 vaccines are approved. Yeah, Moderna and the Pfizer.
Okay.
Pfizer has efficacy of 95% after 2 doses,
Okay.
and that they tested it at 3-week interval. So that was the test. So if somebody says, "Oh, it should be okay," after 6 weeks,
Yeah.
but there's no data to prove
Right.
that. It may be common sense. Common
Right.
sense may say yes, it may be. Yeah, it should be
Right.
effective. But there's no hard data to prove how much efficacy. That's why this controversy is happening.
Like you're taking a
And
chance.
yeah, but there's scientific
Right.
like in the past. Is the reason, scientific reasoning that it should work. So I
Right.
believe that it should work, but we don't know exact what percentage of efficacy.
Now, India has a lot of experience with immunization, smallpox, a lot of like there was I read that there was so many manufacturing in India, even 1970s. So
Yeah, because that's the cheapest way for healthcare in
yeah,
any country is to improve the vaccination.
right.
So that will prevent lots of diseases, and that's the future of medicine actually,
Mhm.
prevention. So if you can have vaccines even against, like for example, cancer, so that'll be like a great
Yeah,
thing.
little breakthrough. Yeah,
Yeah.
yeah. Okay, I'm just doing a quick time check. So we probably have. I just want to be mindful of your time. So we'll do another 10 minutes. My next question is how satisfied you are with the federal and provincial response to all this pandemic, including now the vaccination. Like, what are the like, do you see there are gaps, and what are those gaps, and how we can fix? What is your overall take on the federal and provincial response?
I think Canada has done well overall.
Mhm.
No country had the blue book about this, how to do this.
Mhm.
And we were just learning along the way.
Mhm.
You know, it's easy to shut down everything,
Mhm.
but should be medicine should be practiced called evidence-based medicine.
Correct.
You should do things which have been proved to work. You
Right.
can't just close yourself in a room and say I will stay healthy.
Right.
And so you have to do things evidence-based.
Mhm.
So I think government was trying to do, scientists also, but nobody had a clear idea. That's unfortunate, actually.
Mhm.
You may think that we should have the scientists who are in this field. They should have had more, knowledge about how to treat this, how to take steps, public health steps, all that. But looks like we didn't have that much experience to deal with a pandemic. Now
Mhm.
we dealt with the SARS right in the
Mhm.
past and other epidemics, but how to deal with the pandemic
Mhm.
was something new, and that included travel restrictions and all that,
Mhm.
which we haven't done that in the past. So I mean, I won't blame government totally, but
Mhm.
it will be nice to have a body, pandemic preparedness task force to look into these things, and these things will come in future,
Mhm.
as scientists are predicting. Um, Mortality, I just want to say this, mortality, fatality of a flu, from flu is about 0.1%.
Right.
From case fatality from COVID is about 3%.
Mm-hmm.
And case fatality from SARS was 15%.
Oh, is it?
And so because this disease doesn't have that high case fatality, that's why it was spreading. People were carrying it around without dying.
Mm-hmm.
And that's maybe one reason it spread so much, because case fatality is not that high.
Mm-hmm.
And still from regular flu, about 6 to 10,000 people die every year in Canada. And with this COVID, we have now, I think today we reached 20,000.
Yeah, but the other thing I
So
found is the mortality rate. I found the more deaths in developed countries compared to developing countries. Even I was reading in Pakistan and Bangladesh, the mortality rate is even far lower than in India. So the statistics
you
are
have to take that with a touch of salt,
okay.
because we don't know how the data is managed, how the data
Okay.
is procured.
Right.
And so you probably not comparing apple to apple.
Right. Okay.
So it will be nice, but difficult to explain the reasons.
Right.
What are the reasons? So yeah, speculating. Maybe they got this BCG vaccine. That was one theory.
Right.
In India, people get BCG vaccine. That's why this mortality rate is low. But I heard so many deaths in India, even
Yeah.
my relatives and everything. So I'm
Mm-hmm.
suspecting, are they being counted properly, to COVID?
Mm-hmm. What about the vaccination law? So Canada ordered more vaccination than any other country in the world. But
We
where is the
can vaccinate
vaccination? What
five
happened to
times
those
over.
contracts? Yeah.
Yeah, but it's a global problem.
Mm-hmm.
Canada, I think uh, we will get vaccinated this year. I think most people will get vaccinated by end of this year.
Mm-hmm.
But vaccination I got two doses of
Okay.
Pfizer as a healthcare professional,
Mm-hmm.
frontline. But it has not changed my life. I'm
Okay.
still doing the same things
Right.
as I
Right.
was doing before. So vaccination will not change your life. You still have to do all the safety precautions
Mm-hmm.
until there's a herd immunity, that all the numbers have gone down totally, and everybody is vaccinated. So that may take some time. So
Okay.
that's a lesson.
So my probably will go with one or two more questions. That's it. And yeah, so my next question is, according to you, how long will it take before things go back to normal pre-COVID-19? 1 year, 2 year, 3 years, 5 years? What does it take?
I had a, I had a, nobody knows. The answer is simple.
Yeah.
Um, I had a Japan trip booked. That was booked for March 20, last something.
Okay.
So I was hoping that this year will happen. So it
Okay.
got postponed again.
Okay.
So for 2022. So I'm
Okay.
hoping I can travel to Japan in
Japan.
March of 2022.
Okay.
So the WHO is coming out with strong statement saying pandemic is not over unless it's over everywhere.
Mm-hmm.
So that's a very important message.
Mm-hmm.
So to get vaccinated, African countries, Asian countries, poorer countries, it will take few years, take up to 2024. So you're not out of woods until everybody is vaccinated around
Mm-hmm.
the world. So you will have travel restrictions, you will have quarantine restrictions, these kind of things. Limited, maybe it may change some,
Mm-hmm.
but you will have those kind of restrictions, and life will not be normal until everybody around the world takes control of this.
Okay. So my last question would be, how long you think the government can do this lockdown? I now I find it's more counterproductive. Not only the business impact, but the mental health of adults and children, right? So they're not able to socialize. I can understand to that part, but lockdown means, stay at home, nobody can go out. What's your take on overall that? Because I see there is a lot of other side effect, and that could be long term.
Yeah, that's true. Mental health is being affected severely. So that's a very important issue. I think government wants to open. Ontario government wants to open. It's not good for government to keep
Mhm,
it closed. It's very expensive
mhm,
and disruptive. And today I read in Globe and Mail, there's a Canadian companies, and under the initiative of Toronto University, they are coming out with guidelines. They have done study and research and everything, and they have come out with guidelines how to open a business safely.
mhm,
And these are the guidelines. They are going to come out soon,
mhm,
and that will include the testing, antigen testing, rapid testing, and
mhm,
other advice. So
mhm,
work is in place actually, that they want to open businesses,
mhm,
but with restrictions. So it won't be like normal, like
mhm,
pre-COVID kind of thing. Will be different, but more and more businesses will be able to open. Hospitals are already trying to start elective surgeries. We are already doing it. So slowly we are trying to ramp it up. So hospitals will be normal as well,
mhm.
but not as like totally back to where it was. But
Okay.
you will be able to get your regular surgeries, hernia surgery, those kind
Okay.
of things, knee replacement, this and that,
Okay.
cataracts.
Okay.
So life will be more normal, but these kind of some restrictions will continue for a few years, I think.
Yeah. Okay, I think that comes to our end, and it's almost 1 hour. I just want to say thank you again, for your time, and
You're
appreciate
welcome.
accepting the invite. Really appreciate a lot of insight, and probably, when people watch this video, they will get a lot of doubts will get cleared about vaccination and a lot of things. And again, thank you so much for joining Namaste.
I would love to, Mani, if you could share some comments from your viewers. I'd love to hear like what people are
Yeah, okay, sure.
thinking and that kind
Yeah,
of thing. Yeah.
thank
Thank
you.
you.
We'll
Good
talk to you
night.
later. Thank you. Take care.
Okay.
Good night. Bye.
Bye.